Equinoxe Radio Multimedia. It is another opportunity for us to discuss health-related issues. If you just tune in, you're onto the program You Are in Health show aired on Equinoxe Radio Multimedia. And for presentation, I am Esie Lucy Liengu. Sometimes having a sore on your lip or in your mouth that does not heal with unending or unexplained bleeding. As a result, you find it difficult to chew and sometimes to swallow, and most people tend to conclude that it is as a result of fever. But these are also symptoms of oral cancer or oral cavity. And in this edition of the news, we will be looking at oral cancer, how it can be treated, or the causes with a medic. And sure, we will be discovering our guests in some few seconds. Welcome back, dear listeners and viewers. You are onto the program You Are in Health, and today we'll be looking at oral cancer with a doctor, with a specialist, Dr. NGUAFAC LOYICK. He is a dental surgeon. Good afternoon to you, doctor.
Good afternoon, Lucy.
It is a pleasure having you on today's edition.
Thank you. The pleasure is shared.
And without wasting any time, we go straight away to our questions. Now, in simple terms, how can one define oral cancer?
Well, thank you for your question. Before we dodge a little bit into oral cancer, I would like us to come back a little bit and understand what cancer is. Yeah, so if we want to explain what cancer is in some few words, we can just say cancer is the abnormal cell growth uncontrollably. That is an excess growth of cells in the body. And if they find themselves in the mouth, good, we simply link them now to say that it is called oral cancer. Yeah. So those are some small things that we
need to consider.
Good.
So now, what are some of the main risk factors of oral cancer?
Well, when we talk of the risk factors are things that when we do them in our day-to-day activity, they're going to increase the risk, or they're going to increase the probability of having cancer. So some of these things can be excessive alcohol drinking, and those who consume a lot of alcohol are exposed in having oral cancers. We equally have those who smoke or chew tobacco. So most people who smoke daily and equally consume a lot of tobacco are at high risk of having oral cancers. We equally have another point called dieting. So if you have a low vegetable and fruit consumption daily, there will be a risk that you can easily develop oral cancer. So the World Health Organization, even the World Health Organization always advises us at least to consume one fruit or vegetable in a day. We could have viruses like the human papilloma virus. If you're exposed to this virus, the probability that you are going to have oral cancer is very high. We could have a number of reasons like sun exposure. If you're exposed to sun for a long number of, that is for a good number of time, you can easily develop cancer too. And one other factor that we are not going to be living behind good is going to be aging and genetic syndromes. So most often when we grow older, our immune system becomes weak, and once the immune system is weaker, we are exposed to many viruses or maybe to many pathogens. And since the immune system is weak, the probability that we develop cancers become very high. We equally have poor oral hygiene. If you don't brush properly, if you don't take good or proper care of your oral hygiene, there's a risk that you are going to have oral cancers.
Okay, doctor, before we develop the courses, we would like to give out the numbers for those of you who would like to join us on today's edition with your questions, your worries concerning oral cancer, oral cavity. We have the following numbers: 67054 7049, or I repeat, 670547049, or 65662 2222. I repeat, 656622222 at the end. And now back to you, doctor. We are talking about oral cavity or oral cancer. What are some other causes?
Like I said, there are a number of causes.
Yeah.
I just
Enumerated
earlier. Some people can be genetically predisposition to have oral cancers. That is, if your mom, for instance, had something like breast cancer, the probability that you, the sibling, which is equally a lady, have that breast cancer is very high. So that's why you need to do what we call frequent screening. So that is one other risk of having oral cancers.
And now let's talk about the symptoms. Can we say mouth odor is a symptom that we are experiencing or we have oral cancer?
Yes, mouth odor is one of the perpetual symptoms that you can easily have when you suffer from oral cancers. And you can suffer from mouth odor. It does not necessarily mean that you have oral cancer. So which means it is simply a symptom, which the only person who can give like a clear cut on that is a specialist after having done a good oral examination. So we equally have other symptoms. I don't know if I can cite them.
You can go ahead.
Okay, we have lip and mouth ulcers. We equally have, if you find like some rough spots or like some crusty areas around your lip, you're going to
it's a symptom, it's a sign.
It is a symptom or a sign that you are exposed in having oral cancers. Most often, you can have some symptoms like difficulty in chewing. At times, you can have fatigue. Some people equally have some SARS in their mouth without necessarily being sick. So these are some of the symptoms that when immediately you find them, it is advisable to run to a specialist for consultation.
Now, how is oral cancer diagnosed, or how can we know that this person is suffering from oral cancer? Okay,
thank you for your question, Lucy. Well, like I just explained earlier, it is a practitioner who diagnoses it. So most often when you come for consultation, the practitioner is going to take what we call the subjective signs. That is what you're going to tell him. And equally going to objectivate. Objectivate means he's going to look into the patient's mouth and they will eventually see that there are some eventual symptoms. Most often they can be a tumor. A tumor simply means that something that is an excessive growth in the mouth. And after having seen that excessive growth, he's going to do what we call, most often they're going to do what we call a biopsy. A biopsy simply means we're going to take a small piece of brush, we're going to cut a little bit off the tumor, and then we'll send it to the lab for screening. Now, in the lab, what happens in the lab? It is a specialist that is going to mount that small piece of tumor that was cut, and then he's going to examine the cells, and he is the only person to confirm whether it is cancer or not, which is different from tumor, like I just explained. You can have a tumor in your mouth which is non-cancerous. So we can come to that. We can come to that later.
Okay. In our country, you are a dental surgeon. In our country, how many cases, or let me say in your hospital, how many cases of oral cancer do you receive in a day?
Okay, I can say in a day we don't receive. It's not something that is so frequent. But I can say in a month. Yeah, like when we are in a clinical setting, we can receive basically.
Hello, we have a call on the line. We'll come back to you, doctor. Okay. Hello.
Hello?
Good afternoon, sir. Tell us where you're calling from and your name.
Yes, I'm Mr. Tupu.
Excuse me?
I'm calling from program here at Equinoxe.
Yeah.
They are talking about cancer. Do you know if there is something about cancer of the bone?
We are talking about oral cancer. We are talking about oral cancer. That's mouth cancer.
But I want to ask you whether there is something called cancer of the bone.
Cancer of the bone. Okay, thank you for your question.
Yes.
He got the question, though it is not necessarily in your domain, but he's asking if there is something like cancer of the bone.
Yeah, of course, we can suffer from cancer of the bone. It depends now on, because we mainly classify cancers according to the cell from which they originate from.
Mm-hmm.
So if it is from the bone, it can easily be called an osteosarcoma. So there are many types of cancers, like I just explained, depending on the cells from which they originate from. So it is really possible to have cancer of the bone.
Okay, now let's look at the screening tests available in our country.
Yeah, there are some screening tests almost all over the territory. Like I just explained earlier, it is a pathologist.
Mm-hmm.
Yes, it is. They mainly call it anatomopathologist. He's the one who is going to receive the sample, mount it.
Yeah, we have another caller on the line. Hello?
Yes, hello, good day, madam. How are you?
I'm good, thank you. Hope same. Tell us where you are calling from and your name.
Yes, my name is Mubarak Yauba, calling you all the way from Marwa.
Okay. Your question, sir.
Okay, madam, I have a question for our guest on the program. I really wanted to find out from him, doctor, what is the difference between mouth cancer and mouth odor? It seems like you have explained it, but I did not really capture and distinguish it. How can we distinguish it? Is it possible to have different signs and symptoms that can really make a difference between mouth odor and mouth cancer? Thank you so very much. You have a good
Thank you, sir, for your question. Doctor, you got a question.
Okay, thank you.
He wants to get a difference between mouth odor and oral cancer.
Okay, thank you very much for this question. Well, I'm going to start with mouth odor. Mouth odor, like we say, is bad breath. Bad breath can have like two origins. It can be from the mouth or it can be from the gastrointestinal tract. When it's from the mouth, there can be two or three causes. It could be that there are food debris that have accumulated on the teeth, or there can be a cavity, and in that cavity is going to harbor leftover food debris, and these food debris are going to decay. When these food debris decay, they then come out with that bad breath that we naturally have.
Yes, doctor, come back to you. Another call on the line. Hello?
Yeah, good afternoon, Lucy.
Good afternoon, sir. Tell us your name and where you're calling us from.
My name is for Vitaly.
Okay, your question,
I'm
sir.
calling from Aqua. Vola.
Okay, your question.
Yeah, I wanted to know from the doctor in the studio, because he's saying a while ago that mouth odor definitely means that maybe somebody will suffer from cancer. I want to know from him if maybe in case somebody has mouth odor, that despite the effort that we put in place for things to be okay and that the odor is still persistent, does it signify that the person is a cancer patient?
Okay, thank you so much for your question. Doctor, let's quickly round up. Time is not on our side. Let's round up the first question. The difference, just conclude the difference, then we'll come back to this question.
Okay, like I was just saying, I just concluded with mouth odor. And when we talk now of oral cancer can be, like I just said, oral lesions. When I say lesions, they are like excessive growth of cells in the mouth, which is totally different. And some of these cells they can equally harbor leftover food or leftover alimentary debris, which are eventually going like to like give the scent, and which is completely different from mouth odor. But which means if you have mouth odor, it doesn't necessarily mean that you have oral cancer, but it can be a sign that you have oral cancer.
Okay, now briefly, now explain to him the last question, please.
Yeah, okay. Coming back to the last question, he said no matter what he does,
the odor does this, it persists.
The odor persists. Like I said, there are two origins. It can be either from the mouth or it can be either from the intestines. If normally when we receive such patients who come for bad breath, the first thing we do is S&P. S&P means we have to clean all the teeth and all the gums. We keep them clean, and we have to like clean all the cavities, like they call them caries, because some of these caries can harbor leftover food, and when we have filled all the cavities and the patient is still complaining that he still has bad breath, we go now to the second origin. Like I said, we can be gastrointestinal. Gastrointestinal means that it's coming from the stomach. So the person can belch, for instance, or maybe he has eaten things, maybe like garlic. And one other thing, it could be psychological.
Okay. All right, thank you very much, Dr. NGUAFAC LOYICK. He is a dental surgeon, and we're talking about oral cancer. Due to time, we will not be able to exhaust all the questions. But if you have any problem, if you have any problem concerning your mouth or maybe your oral cavity, you should be able to visit a dentist to see. Visit a dentist so that we can resolve all your worries. Now, ladies and gentlemen, for presentation, I have been Lucy Liengu. We have come to the end of this edition of the program you and held on Equinoxe Radio, a multimedia, the technical dashboard. We had Bertrand Bonzini and of course Raphael Dipanda. We thank you for your keen attention. Next week, Thursday, same time.